Hey everybody, thanks for posting on this thread. It was pretty, it's pretty cool to see all the comments that are going through here. I want to point out one thing that I'm noticing in this thread, and it's ironic, right? Because as PTs, we don't want to be considered an intervention. We are a profession, right? We aren't hot pack ultrasound, massage, and e-stim. We are considering ourselves movement specialists, and we talk about doing the assessment to determine the appropriate plan of care. And when patients see PT from the outside, they may have that perception of PT as an intervention, the Hummer intervention, Aaron Hackett's shirt, hot pack ultrasound, massage, and e-stim. But yet we're doing it to chiropractic. We aren't associating chiropractic as a profession. We are associating chiropractic as an intervention. And I think it's interesting that even though we hope that others don't do that to us, we are very quick to do that to that profession. So I think that maybe we should check our biases a little bit and understand that it's not an intervention. Chiropractic is not an intervention. It's an entire profession. Physicians, chiropractic physicians. Another thing that I find interesting is there's good and bad in every profession. Right? I don't necessarily refer to any of the chiropractic physicians around me because I just don't think they do great jobs, and I've had conversations with them and I've had these discussions with them, and it's volume over patient care. And that's fine because there are PTs that are volume over patient care, right? And so I'm not going to pigeonhole them and say they're all bad, because then that would be pigeonholing our profession and saying we're all bad. And I know that's not the case. But yeah, keep an open mind that there are some reasons to refer out of your clinic. And I think Doug it's easier for me to do videos than it is for me to type. And I think Doug posed an awesome question. Do we refer to other PTs? And I think that as a clinic director, because that's the position I'm in right now, as a clinic director, I can understand the businesses not wanting to refer out because they're going to lose productivity. They're going to lose the money, right? They're going to lose the revenue. But in the end, we have to be doing what's best for the patient. And if referring out is what's best for the patient, then that's really what we should be doing. And whether that's a chiropractic physician, an orthopedic surgeon, another PT, it shouldn't really matter. One of the reasons why I would refer out to another PT is location. If a patient wants to use their insurance and we're out of network, you try to make the patient experience, hashtag Jerry Durham, you try to make the patient experience as good as possible. And if I know of a therapist that's going to give a good patient experience and gets good outcomes that's closer to that patient's house, I have no problem referring out to that physical therapist. But if I don't know of any physical therapist, I'll be honest with you, I got one patient that's 60 miles from here, and between me and him, that 60 miles, there's only one PT that I trust. So that patient actually chose to drive out to me because he trusts me also. And so you refer to who you trust. You don't just refer to anybody. But yeah, everybody, thanks for posting.